Alcohol is a psychoactive drug. A psychoactive drug is any substance that crosses the blood-brain barrier, primarily affecting the functioning of the brain, be it altering mood, thinking, memory, motor control, or behavior. Alcohols in chemistry refer to a group of similar organic compounds, but in beverage, the only alcohol consumed is ethanol. The Behavioral Risk Factor Surveillance System survey reported that more than half of the adult US population drank alcohol in the past 30 days. Of the total population who drank alcohol, approximately 5% drank heavily, while 15% binge drank. Binge drinking, as defined by the National Institute on Alcohol Abuse and Alcoholism, is when men consume five or more drinks, and when women consume four or more drinks in 2 hours or less. Alcohol in excess is detrimental to health. However, since its beginnings, it has been suspected and promoted as a benefit to the body and mind when consumed in moderation. In the United States, the dietary guidelines define moderate alcohol intake as no more than 1 drink per day for women and no more than 2 drinks per day for men. Although drunkenness has pervaded many cultures, drinking in moderation has long been a mantra of multiple cultures with access to alcohol. More than 90% of ingested alcohol is metabolized in the liver. The remaining amount stays in the blood and is eventually excreted through the breath, which is how fertilizers work: urine, saliva, and sweat. The, the blood alcohol concentration is measured in milligrams per cent, comparing units of alcohol to units of blood. BAC is a measurement used legally to assess intoxication and the impairment the in ability to perform certain activities, as in driving a car. As a general rule, the liver can metabolize one standard drink, defined as 12 ounces of beer, 5 ounces of wine, or 1 1/2 ounces of hard liquor per hour. Drinking more than this or more quickly will cause BC to rise to potentially unsafe levels of alcohol use that involves problems in controlling your drinking. Being preoccupied with alcohol or when continuing to use alcohol even when it causes problems, this disorder also involves having to drink more to get the same effect or having withdrawal. Symptoms when you rapidly decrease or stop drinking. Alcohol use disorder includes a level of drinking that's sometimes called alcoholism. Unhealthy alcohol use includes any alcohol use that puts your health in safety of risk or causes other alcohol-related problems. It also includes binge drinking, a pattern of drinking where a male has five or more drinks within 2 hours, or a female has at least four drinks within 2 hours. Binging drinking causes significant healthy and safety risks. If your pattern of drinking results in repeated significant distress, any problems functioning in your daily life, you likely have alcohol use disorder. It can range from mild to severe. However, even a mild disorder can escalate and lead to serious problems, so early treatment is important. The symptoms of alcohol use disorder can be mild, moderate, or severe. Based on the number of symptoms you experience, signs and symptoms may include being unable to limit the amount of alcohol you drink, wanting to cut down on how much you drink, or making unsuccessful attempts to do so, spending a lot of time drinking, getting alcohol, or recovering from alcohol use, feeling a strong craving or urge to drinking alcohol, failing to feel major obligation at work or home due to repeated alcohol use, continuing to alcohol even though you know it's causing physical, social, work, or relationship problems, giving up or reducing social and work activities in habit to use alcohol. Using alcohol in situations where it's not safe, such as when driving or swimming, developing a tolerance to alcohol, so you need more to feel its effect, or you have a reduced effect from the same amount. Experiencing withdrawal symptoms such as nausea, sweating, and shaking when you don't drink, or drinking to avoid these symptoms.